everyone, and welcome to my presentation on night eating syndrome for Psychology 2300. So, what is night eating syndrome? Night eating syndrome, which is also known as NES, is an eating disorder characterized by waking up to eat at night. And individuals may eat at least 25% of their total calorie intake at night. NES often occurs comorbidly with insomnia, which is lack of ability to sleep, and it affects about 1 to 1.5% of the general population and 6 to 16% of diagnosed obese patients. NES may be caused by a variety of factors, and it is different for every individual. Some factors may include disruption of the circadian rhythm, which is referred to also as your biological clock, and when that is messed up, it often makes you think that you should be awake at night and asleep during the day. Genetics may play a factor in this. Comorbid mental health disorders such as depression and anxiety may influence this. Other eating or substance abuse disorders such as bulimia nervosa or binge eating disorder are often associated with NES. And daytime dieting may also be a giant factor in this, as people are most likely to break their diets at night. So some of the symptoms of NES are waking up in the middle of the night to eat, and this can occur for weeks or months, and a person may wake up multiple times through the night. It's important to note that a large amount of a person's calories are consumed during these periods, and this is not usually in the form of a normal meal, but more snacking multiple times through the night or binge eating. And this can lead to a decrease of appetite during the day, and also to hiding food due to feelings of embarrassment or shame. Depression and anxiety may also be influenced by NES and can be signs of this disorder. Some potential dangers that can be associated with NES, especially long-term, are high cholesterol, high blood pressure, diabetes, obesity, cardiovascular problems, gastrointestinal problems, and increased anxiety and depression, specifically at night. It's also important to note that individuals who suffer from NES may experience significant distress or impaired functioning due to lack of ability to sleep, and this can be dangerous in all situations. And finally, for recommended treatment options, cognitive behavioral therapy is the most widely accepted and has seen a lot of success with NES. However, melatonin, phototherapy, and mind-body exercises have been used and are recommended to try and reset the circadian rhythm, which may help those suffering from NES to sleep through the night, thus reducing symptoms, as well as weight management problems for those who struggle with dieting, and antidepressant medications are also recommended for those who are suffering from depression as well as NES, as this may relieve some symptoms of NES. And these are the references I used in this presentation. Thank you so much for listening.